Our final presentation will be from Tawara Goode, the Director of the National Center for Cultural Competence at Georgetown University. She's also the Director of the Georgetown University Center for Excellence in Developmental Disabilities and an Assistant Professor in the Department of Pediatrics at Georgetown University Medical Center. Tawara is a recognized thought leader in the areas of cultural and linguistic competence, and we are so pleased to have her with us today to discuss her work looking at the pandemic's impact on people with disabilities and how frameworks can be used to improve how we approach these critical issues. Tawara? Tawara, it looks like you're still on mute.
All right, I found my way off mute. Thank you very much. Today, my remarks will be looking at the multiple perspectives of the impact of COVID-19 on persons with disabilities and lived experience with the emphasis on data and policy. I will do my best not to repeat what has already been said by co-presenters. I am going back on slides. Previous slide. So what is it that we know about the impact of COVID-19 on persons with disabilities? So I can say that regardless of all of the data that's been collected, we still don't know enough, and data are still indeed being collected. And as we look at some things that we do know, I won't repeat what has already been said by an esteemed colleague at Kennedy, at Johns Hopkins. But what we do know is that people with disabilities had delayed access to care. They had poor quality of health care and mental health care. They experienced discrimination and biases by healthcare professionals, including life-saving therapies. They experience increased isolation, job loss, disruption in supports and services. We also know from this literature there's extensive deficits in the nation's current data collection system. It was alluded to earlier, particularly looking at examining COVID-19 and its impact by disability, race, ethnicity, language spoken across the United States, territories, and in tribal communities. Given that we hear a lot around statistics, I thought it was really important to bring up this particular quote. I find it very powerful, and it actually drove some of the work that we have done and are publishing about the COVID experience. So that it's basically saying that statistics are people with the tears wiped away. That is a very, I find, powerful statement. And so if we go back and we have that lens of people with the tears wiped away, during the early stages of the pandemic, we at the Georgetown University Center for Excellence in Developmental Disabilities, we went about collecting just stories and experiences from a range of people that had intellectual, developmental, and other disabilities. And this happened between April and May of 2020. Again, just 11 people. These individuals were from diverse racial, ethnic, and cultural backgrounds. And getting these stories, it really gave us a chance to look at the statistics before the tears could be wiped away. So in other words, we're able to look at the social cultural context of the lives of individuals living in the District of Columbia during COVID-19. I want to share with you a framework that we used to analyze these 11 stories, but they were indeed powerful. This is a framework you can access on our website. We call it Disabilities Disparities Framework. And if we look at public policy and resources and think about that during a time of COVID, we know that those public policy resources, both in the public and private sector, had a significant impact on the level above, meaning the availability of supports and services, including healthcare, the accessibility, the acceptability, the quality, and the utilization. And as we think about the accessibility, the acceptability, and in particularly the acceptability. I think a lot around the cultural implications of what that is. Sometimes services were indeed available, but they certainly were not acceptable to the individuals who need that. And again, as we think about people with disabilities during this COVID pandemic and in every aspect of their life, it really has a significant impact. So we use this framework to analyze data. And so among the 11 people that we saw that had intellectual developmental and other disabilities, we found that 9 of 11 had issues around accessibility, 8 of 11 around availability, acceptability as indicated in the slides that you see, quality 1 of 11. We know that each person experienced disruption and utilization of services due to widespread impact of the pandemic. And they had major limitations on aspect of their lives, as did many others across the country. All of the persons who were interviewed reported disparities in supports and services that included health and mental health care, in-home supports, physical and other therapies, public transportation, employment, and again, the days that they were able to work, performing independent activities of daily living, and the facility-based services and closures. We also knew in terms of access to the capacity to use technology, which has been referenced repeatedly, what we did see is that many people could not indeed access what was needed because almost everything was web-based. And then finally, when we look at the mental health impact, we saw fear, vulnerability, anxiety, frustration, and isolation that really impacted at least these individuals that we heard their stories. All right. Another effort in which we were engaged during this period of time was an outside of a core grant that we have, Reconciling the Past and Changing the Future, and we're looking at engaging young adults with intellectual and developmental disabilities who also have mental health needs and researchers in research. In this project, we were able to get additional funding to use an analytical framework and an existing database to identify service experience and outcomes across diverse populations. And we did this in real time. My partners in this are the University of Florida, Jessica Kramer, and Joan Beasley, the Center for Start Services at the University of New Hampshire, that has a focus specifically on individuals with intellectual and developmental disabilities who also have mental health needs. We were engaged in this research together. We use this framework that I created called the Convergence of Cultural Context. And as you can see in the middle, there's a child, the youth, and adult. And this is really looking at the multiple cultural identities in the cultural context that child, youth, and adult may bring to the table. In this instance, a person with disability. In the next circle, we see the family. And so that we look at the impact of the family, and again, the cultural context in which the child, family, and adult are living. And then we'd look at that child, family, adult, again, within the cultural context of the communities in which they live across the country. And lastly, looking at the socioeconomic and political and demographic environment. And that was impacted significantly by COVID. So we use this framework that we use in many ways to analyze an existing data set. And the outer ring that you will see are the many, many different services that persons with intellectual, developmental, and other disabilities may need to access. And so from the healthcare system to early intervention to mental health care system, et cetera, that what was the impact of COVID for this particular population? And so again, these are things that we were able to glean from the data, so that the Center for Start Services administered a survey for caregivers of persons with intellectual and developmental disabilities with mental health needs. And there were about 1,455 surveys, as you indicate, as you see there. So this was during March and July of 2020, collecting these data. And so the things that we learned just using this convergence of cultural context framework was the sheer number of systems and sectors that family caregivers needed to navigate in order to meet the needs of their children or adults during this time period. We found that there were disparities in service systems needs and use based on race, ethnicity, language spoken, and other cultural factors, which we were able to glean from using this framework. And we also looked at the extent to which telehealth and virtual services were available, accessible, acceptable, and utilized by the caregivers. And that varied significantly given this specific population. So looking at telehealth as a one-size-fits-all, it was not always a good fit. And lastly, the impact of the pandemic on the person with intellectual and developmental disability, the caregiver, and the family unit as a whole. But we were able to do that using this framework to examine the social cultural environment in the communities in which they live. And so again, as we think about and answering the question, like what do we know about what impacts people with intellectual and developmental disabilities during the time of COVID, using different ways to examine that is really very important. The last one I'd like to share with you is a conference or a symposium that was convened in May entitled Eliminating Compounded Disparities for People with Disabilities in the Year of COVID-19. It really looked at the experiences in New York City. However, the persons who contribute to this brought perspectives from across the country. And these are the panels that were offered. I had a large role in planning this, the symposium. But understanding the political determinants of health and their impact on persons with disabilities, the lived experience, specifically communities of color, disability, and the physical and mental health impact of COVID-19, which you've heard alluded to already, public policy and government response in a pandemic, the lessons learned, and lastly, the way forward. And so as we think about not only what we should be looking at, a systematic way of being able to do that, in addition to data collection, as this symposium shared, to engage members, diverse members across the country and in specific geographic locales. These were the partners, as you see here, Pace University, HRC New York, the mayor's office there, Department of Social Services, and Trinity Church, Wall Street, again, engaging the faith community in these efforts. So I'd like to be able to summarize. My closing thoughts are that COVID-19 is still with us, and it probably is going to be with us for many years to come. And we have to continue this learning about the impact on persons with disabilities. One particular area that's a huge deficit and has been alluded to by both my co-presenters is that we have to collect, analyze, and report data that's inclusive of the cultural context, including race, ethnicity, and primary language, but to go deeper from that, looking at a socioeconomic status and other cultural factors. These, I think, are key and critical when we think about how we are looking at prevention, treatment, and other supports for persons with intellectual, developmental, and other disabilities for future public health emergencies. And lastly, it really is essential that our knowledge about the impact on persons with disabilities, that is not simply limited to quantitative data. Again, I can't emphasize that enough. We have an obligation to really collect data in many, many different ways in which we can gain insight. This has impact on how policies inform our resource allocation, the needed supports and services in order to advance equity. Lastly, I want to end on the work of Daniel Dawes, who was a keynoter for that conference. And he's placed a lot of emphasis on policy. And I think that we talk about the social determinants of health a lot. However, in his wisdom, for every social determinant of health, there was some preceding legal, legislative, regulatory, or other policy decision that resulted in the social determinants of health. And those are the political determinants of health. So as we continue to look at the experiences of persons with intellectual, developmental, and other disabilities across the lifespan and during our COVID pandemic, that we cannot ignore the political determinants. And with that said, I will stop. I know that we need time for questions.
Great. Thank you so much, Tawara, for sharing those powerful narratives and the value of using frameworks to better understand the issues and inform the response, and for sharing information about the symposium.